like saying welcome back, everybody. It's March 30th, Gary. It's been a month since we last were here. Our schedules didn't coincide, but honestly, fortunately, it's been a kind of a COVID month-free conversation time. Haven't had to talk about COVID every night.
It's been a quiet month.
Yeah. So, but let's see where we're at. It's the end of March. I want to start off as usual with our local epidemiological slide. So this is Sutter data on our first slide, which talks about the cases, and this is the one we always show. You can see our big bump, but you see we've been coming down. The yellow line is our 7-day average of cases. Very low. It's back to where it was pre-Omicron surge, sorry. Gary, I hear nobody in the hospital right now with COVID, right?
Yeah, we've had no cases in the hospital for 10 days.
Great.
That's a phenomenal statement.
But when you look at the green dots, the percent positivity, it did not go to zero, it's flattened out. Perhaps is a little bit of an uptick, and I think we're going to see later on here what's happening around the rest of the world, so we might pretend what's going to go on with us. So let's look at the rest of the world.
Yeah, so I think that's important because I think what everyone needs to remember is that the Omicron strain for the people who are vaccinated is going to be an ambulatory disease. It's going to spread asymptomatically and subclinically. And I think that's what we're seeing in parts of the world. So I'll show you, this is a map that the New York Times took from the World Health Organization. These are the hotspots for COVID around the world right now. And this really relates to the new strain of the Omicron strain called BA2. And you can see that Australia and Western Europe, parts of Southeast Asia, South Korea, these are hotspots right now for cases, not necessarily for hospitalizations, however. And I'll show you the next slide. The hotspot graph was just raw cases, but this is the number of cases per million. Remember, this is cases, not hospitalizations. And you can see South Korea is at the top there because South Korea has always done an incredible job of testing. They have been testing everyone, and sometimes multiple times during the course of illness in case they get reinfected. South Korea shows a number of cases because of testing, but then you also see that Austria, Liechtenstein, Iceland, New Zealand, Germany, France, the UK, Canada, at the very bottom there is the United States. So we haven't hit the BA2 surge yet. So I want to take a little bit of time, Gary, if it's okay, to talk about what are the variants, and I just kind of remind everyone of that. So I made this table for everyone. This is a table of the variants of concern by the US, by the CDC in the United States. And I just put a red box on BA2. What is BA2? BA2 is 2 of 3 subvariants of the Omicron variant. So the Omicron ancestral variant is B.1.1529, but BA1 is this first subvariant, BA2 is the second one. And what we know about BA2 is that it's 2 to 4 times more contagious than the Delta strain. And so because of that, we're going to see a number of cases, but it's milder. So it's more contagious, it'll have more viral fitness, it'll swamp populations, but it may not result in hospitalization if you're vaccinated. And that's the key there. And then I also want to put a box at the very lower area, just in case you've been hearing about this. There are some emergence of recombinant variants, where variants kind of come together. There are 2 Deltacrons, which is the BA1 lineage with the Delta virus. And then there's the stealth Omicron, which is actually BA1 and BA2 kind of merging into one specific variant. Those are very, very rare. We don't see them much in Europe or in the US. I just want to mention them in case people are hearing about that in the news. Let's move on to kind of what's going on. So the big question with the BA2 variant is we know it's more contagious, it's going to have more viral fitness, we're going to see more cases in the community, mild cases, asymptomatic cases, subclinical cases. If you're vaccinated, it's going to be mild. It's just as dangerous in the unvaccinated people as the other variants. So being unvaccinated is going to result in hospitalizations. In our county, about 81% of people are fully vaccinated with 2 doses. I think it's maybe 50% have the second booster dose. And so in this county, we have about 19% of people who are not vaccinated. That 19% of people as a cohort are going to be the most vulnerable to being hospitalized. So the higher your vaccination rate, the more you're going to weather another bump in cases. So in Germany, the first slide I'll show you here, Germany's had a bump in cases, and I'll show you the BA1 lineage of Omicron was their first bump, and then the BA2 lineage at the top shows their second bump. But despite Germany have more cases, in the lower graph, you can see the death rate from Germany, where the arrow is, has kind of flattened out. So Germany has had a swamp number of cases of BA2, but it hasn't resulted in mortality, at least not yet. The next slide is Italy. Now remember, Italy had a really tough time with the pandemic, the very first part, and as you can see, the BA1 variant was a big bump, and the BA2 variant has kind of made a second hump or a second surge in the Italy cases. But the mortality rate, the death rate in Italy is low, and despite having BA2 overlap the Omicron BA1 subvariant, the death rate in Italy has gone down. And then the next one is the Netherlands. The Netherlands shows that they had a BA1 hump. The BA2 surge was remarkably higher than the first Omicron surge they had. So you had this BA1 surge, then you had the subvariant BA2 on top of that. But the mortality rate, the death rate in the Netherlands has been very, very low. And that tells us that this virus is circulating in the community, but in a vaccinated cohort, it's not causing a lot of deaths. I think that's what's going to happen here. We're going to see a lot of community spread, but it's going to be good and bad. We're taking off masks. You can go to church without a mask. You can go to a restaurant without a mask. You can go indoors without a mask. You still can't go into a medical facility or public transportation yet, or on an airline without a mask. And also, it's in the spring and summertime. So we're going outdoors, we're not coming indoors. If you put those together, I think what's going to happen is we're going to see a lot of community spread, a lot more cases in schools, however, but we're not going to see hospitalizations unless someone is unvaccinated. So a key question in the ER or in the urgent care clinic, if someone comes in with COVID, is, have you been vaccinated? If that person has not been vaccinated, then you want to ask yourself, are they likely to get sick down the road? Oh, they have diabetes, they're older, they are immunosuppressed. I need to worry about this patient more.
So we're seeing these things from Europe, and historically we've had a surge or a bump in a short time frame after Europe. So what are we seeing locally in terms of the virus?
So the next slide I'm going to show you, this is coming from the CDC, and this is a weekly slide, and this is a weekly cutout, and I separated the last week to the right, and so I'll put a little red box around that one. And you can see that about almost 100%, 99% of what's circulating in the US now is an Omicron variant. However, the BA1 variant is going down and the BA2 variant is going up. So we're seeing the BA2 variant become a little more with viral fitness. Now, I'm going to put a box on the lower left-hand side. In California, 99 to 100% of the variant sequence in the last week have been the Omicron strain, and the BA2 strain is about 3%. So the new subvariant, about 3%, and it's likely to go up in California as well. This doesn't mean we're seeing more hospitalizations, more community spread.
So that raises the question, so it's more contagious, less virulent. How is it holding up to our current vaccine?
So that's the $1 million question. You know, we've been fortunate to have 2, if not 3, of the best vaccines in the world. And there was a paper just in the New England Journal of Medicine kind of addressing this. This paper comes out of China, and the New England Journal of Medicine article showed that, and I'll show you the table here. It shows that what are your neutralizing antibody levels after vaccination. And so I'm going to draw a box around the last category. So at the very bottom of this, these dots represent the level of neutralizing antibody. WA1 is an ancestral strain of COVID. BA1 is the Omicron subvariant. BA2 is the Omicron second subvariant. And in the red box, this represents people who have received the first booster. So they received 2 doses in the first booster. And as you can see, neutralizing antibody levels drops off a little bit with the subvariants, and then it boosts up again with the first booster. So the first booster still develops good immunity. The third dose of a Pfizer vaccine, and you can extrapolate that to Moderna, well, you'll still have good antibody protection. The question is how long? And how long is a bit of a misnomer, Gary. I have another study that I didn't have time to really show it here, but your cell-mediated immunity or your T-cell memory is long-lasting. It's been 2 years in this other publication that I read. So even if your neutralizing antibodies drops off a little bit, if you get a community spread or a subclinical course of Omicron, you're going to bump your immunity even higher. But the vaccine holds up against both of the Omicron subvariants.
Good. That's the good news. Is our current vaccine still working well?
Right. That's right.
All right. So then, what's most topical in the news? And I think just yesterday the FDA approved a second booster, i.e., a 4th shot for those over 50 and immunocompromised. So there was some debate about the data and how strong that recommendation is, because you read a lot all over all over the page, in the pages of the newspaper. So what is the data for that?
Yeah, so I mean, the Press Democrat had it in the paper today, I think.
Yeah.
The Washington Post and New York Times has picked it up. And I'll show you, I'm gonna show you a slide. This comes right from the FDA website.
Okay.
So March 29th, FDA website. The second booster for Pfizer, which is the 4th dose, you had the series, the first booster, the second booster. The second booster of Pfizer or Moderna is approved by the FDA in people over the age of 50, providing it's at least 4 months after the last dose you had. And you can mix and match any vaccine by this, because they say in any authorized COVID vaccine. Okay. So your booster can be either or, depends on what you had. And then in immunocompromised patients, the FDA goes on to say that the Pfizer booster is, the second booster dose of Pfizer is good for kids, anyone 12 and older that are immunosuppressed. The level of immunosuppression here is solid organ transplantation, so that's pretty immunosuppressed. Yeah. That's not just, I'm on dialysis or I'm pregnant, you know. Okay. And then the second booster of Moderna is over the age of 18, not over the age of 12. There's a little split in those vaccines. And the data here, I'll show you on the next slide, this comes from the Israeli Ministry of Health, where they had a huge study of more than 500,000 people. It was at the beginning of the year. It was put on the Ministry of Health's website on March 24th. So this has not been peer reviewed. This hasn't been peer reviewed and beat up by people, but it does come from the Ministry of Health. And what it basically shows is that in this big study, in Israelis, it showed that the total death from COVID in people who only had one booster was 0.1%. And the total death of COVID, if you got a second booster, was 0.02%. So 0.1 versus 0.2%. And then they broke it down by age, and I've kind of shown that in the slide, that the older you get, the bigger the spread. And so it shows that in people who are older, over the age of 60, there is a survival benefit to getting the 4th dose for the second booster. And they also show this in this hazard ratio graph on the next slide. This shows the big split where the pink is people who only had one booster, and the second, and the lower one there in the teal is people who have received the second booster. And there's clearly a split in this 40-day study. So the older you are, the second booster should be helpful in people who have waning immunity. And I think that's where the benefit is. Now, why the FDA said under 50, I don't know. Because the study was really powered, more for over 60. But what it tells us is something we all kind of knew intuitively. The older you get, the more you lose your immunity, and the faster your neutralizing antibodies drop off, and your memory T cells are a little bit more fragile. They don't remember the vaccine as much. So I worry about people who are remarkably older with comorbidities. The other thing the study showed that older age, men, COPD and heart failure and diabetes were the big risk factors in Israel for higher mortality. And the one thing I would say about Israel, it may have a different demographic and a different ethnic mix than other countries. And so you can sort of extrapolate it in your population, but it is somewhat of a different genetic pool of people.
So when I read about their recommendation, the data supported this for the elderly, yet the recommendation came down to age 50. So I saw so many different opinions about the timing of this. Should we just encourage everybody over the age 50 get a booster now, or should we practice some discrimination on when that should occur? Like, when we get a new surge, or are you putting yourself you're going to Europe or something, want to do it before then? What's your recommendation around that? Should just be like everybody do it now, or have some little license there?
So I've only seen a few cases in the hospital, people who were vaccinated and then came in, and they were elderly, they had comorbidities, and they were immunosuppressed. So if I'm Dr. Kanan in oncology, then I'm going to be much more careful and perhaps more apt to give those patients a booster. But if I'm seeing the 55-year-old or 51-year-old, if you get a booster right now, I don't know if later on you're going to need another one.
Right.
So what am I personally going to do? I'm going to probably wait, because I know for me, after having 3 doses, even though my last dose was in the fall, my 3rd dose, that if I get the BA2 variant, it's going to be an outpatient disease, it's going to be a mild cold, it's going to bump my immunity. But what I'm really concerned about is right before the fall, when we're going to see the flu and probably another surge of a new variant. That's when I'm going to probably get my 4th dose. So I'm going to hold out. It's not an urgent time right now.
Right.
And I just think that people need to know that The really frail elderly are the ones we need to worry about. Most of our patients who are just anxious about it, not a big deal. Now, if I have a 60-year-old HIV patient who's really well and stable, it might help them a little bit, but then again, even they're not going to get very sick from it.
Yeah, and the thing we have to counter with that is vaccine fatigue. So,
Right.
you know, the boy who cried wolf says vaccine every 4 months isn't going to last forever. So
Yeah,
we have to spend that carefully.
Yeah, you know, and we're actually seeing a little bit of influenza upticking right now. H3N2 influenza is going up a little bit, and if we need everyone to be vaccinated for not just the pandemic surge, but a new flu season, if it's going to be a rough season, we don't know.
Yeah.
Then you really want people to be, you know, like you said, ready and willing to get vaccine and not sick of hearing about it.
Okay, thank you. I'm going to switch gears a little bit right now with just some quick business. I mentioned this at our all group meeting, but just to let everybody know, and I'll follow up with an email on this, but our HealthStream assignments are due on August 30th. There's just 2 courses. Should last you about an hour, not particularly difficult to do, so I'm just encouraging people to jump on that right away. I'll follow with an email with the link for that. So that's what we got. Gary, anything else you want to add?
Well, if it's okay, and I wanted to say happy birthday to my wife, Lucy. So Lucy turns 30 today, and I wanted to reach out and say happy birthday to Lucy.
Gary, this is an educational forum. This is not particularly the right place for that, okay? So can you try not to do that next time? Thank you.
Congratulations, Allison. I don't know how you did it.